Hi, my name is Ashley Sudam, and this is my presentation on intellectual disabilities. What is an intellectual disability? It's a term used to describe someone who has certain limitations in cognitive functioning and skills. There are many different types and causes, and it's the most common developmental disability. It's a condition that limits intelligence and disrupts abilities necessary for living independently. Criteria for diagnosis includes having an IQ below 70, significant limitations in intellectual functioning. That's broken down into three domains. The first is conceptual, and that includes skills in language, reading, writing, math, reasoning, knowledge, and memory. The next is the social domain, which is skills in empathy, social judgment, interpersonal communication skills, and the ability to make and retain friendships. Lastly, it's the practical domain, which includes self-management in areas such as person care, job responsibilities, money management, recreation, and organizing school or work tasks. The last criteria is that the condition appears before the age of 22. Some common causes include genetic conditions. This can be caused by abnormal genes inherited from parents, when genes combine, or other genetic reasons. Another common cause is complications during pregnancy. This can be the way cells divide, alcohol consumption during pregnancy, or infection during pregnancy. Also, problems during birth, which could be the baby not getting enough oxygen, or diseases and toxic exposure, which the examples are whooping cough, the measles, meningitis, or extreme malnutrition. The prevalence rate in the United States is approximately 6.5 million people, and that's about 1 in 6 children that have one or more developmental delays. Of the global population, it's approximately 1 to 3% of people that have an intellectual disability. Different types include Down syndrome, Fragile X syndrome, fetal alcohol spectrum disorder, also known as FASD, Sanfilippo syndrome, Williams syndrome, and autism. And some symptoms include high risk of hypothyroidism, which is when the thyroid glands can't produce enough thyroid hormone, resulting in delayed motor skills, tiredness, and weight gain. Another symptom is muscle atrophy, which is when the muscles weaken, making it harder for joints and bones to stay in place. Down syndrome is a common intellectual disability. It's caused by extra copies of chromosome 21, and approximately 1 in every 772 babies in the United States are diagnosed with Down syndrome, while others are diagnosed later in life. Different types of Down syndrome include trisomy 21, that includes 95% of people with Down syndrome, mosaic, which is 3% of people, and translocation, which affects 2% of people with Down syndrome. Common characteristics include stubbornness, impulsivity, and temper tantrums, and common attributes include a flattened face, almond-shaped eyes that slant up, and also a short neck. Sanfilippo syndrome is one of the more uncommon intellectual disabilities. It's caused by a defect in one of the genes that make enzymes needed to break down heparan sulfate. This causes a buildup of the heparan sulfate, and that can cause damage to organs, affect growth, and mental development. This affects 1 in 70,000 births. Again, some are diagnosed later in life. And there are 4 different types of Sanfilippo syndrome, differentiated by genetic cause. These types are type A, type B, type C, and type D. And common symptoms include speech and developmental delays, developmental regression, seizures, and sleep disturbances. Common attributes include short stature, full lips, heavy eyebrows, and often a larger head size. For physical fitness and intellectual disabilities, both physical fitness and cardiovascular endurance are commonly lower in people with an intellectual disability, and most exercises work best when tailored for someone with an intellectual disability. It's also common for people with an intellectual disability to have underlying medical conditions, so they must take necessary precautions when exercising. The effects exercise has on intellectual disabilities are it helps improve physical characteristics such as cardiovascular fitness, strength, weight, and balance. It helps boost self-esteem and can improve behavior. It decreases the risk of obesity and it also strengthens bones and muscles. Some additional benefits of being physically active are an improved level of intellectual functioning, an increase in focus and the ability to concentrate for prolonged periods of times. It can stimulate the brain to improve efficiency of brain neurotransmitters. There's a decreased risk of additional chronic conditions. This can include depression, obesity, and cardiovascular diseases. It also improves sleep quality, behavior, and also attention. I wanted to include the Special Olympics in here. This is an organization that delivers high quality training for people with and without intellectual disabilities to play sports on the same field. It offers more than 30 individual and team sports for players ranging in age from 2 to 99, and it allows individuals with intellectual disabilities to gain social skills while keeping their body active and engaged. I have both volunteered for Special Olympics and participated in Special Olympics, and I really think it's a great way for people with a disability to stay active and to communicate with their peers. It also promotes self-esteem for them. Treatment and management, there is currently no cure, but most can improve functioning over time. There are support services in place that allow someone with an intellectual disability to function normal in society. Those include special education and academic support, vocational programs, housing options, psychological services, and transition services. For this case study, we have a 14-year-old female who is 5'4". She weighs 150 pounds and her body mass index is 25.7. She has a resting heart rate of 65 beats per minute, and she has a low resting blood pressure at 90/60. That's known as hypotension. She was diagnosed with Down syndrome when she was 5 years old. She suffers from low muscle tone and difficulty in communication. Along with Down syndrome, she also suffers from hypotonia, which is excessive joint flexibility, an increased risk of obesity, short limbs, and neurologic and language developmental delays. She does physiotherapy and participates in multiple physical activities. Some of her favorite include swimming and dance. For exercise testing, for the first one, aerobic test, I did a 6-minute walk test. I chose this because it's a low stress test and she also currently practices walking regularly during the week, so it's something that I know she'll be able to be confident in. For the 2 resistance test, I chose the modified squat for muscular endurance. This is going to be the sit to stand. This is a low intensity exercise that will help with everyday activities, such as getting out of bed or walking up and down the stairs. For muscular strength, we're going to do the hand grip dynamometer, and this is going to help evaluate overall muscular strength levels. For flexibility, we're going to do the common sit and reach test, and this will help us evaluate her low back mobility. And for her exercise prescription, for her aerobic training, I'm going to have her do that 2 to 3 times a week at a low to moderate intensity for about 20 to 30 minutes, whatever she's feeling that day. And since she said she liked swimming and dancing, she can do that for aerobic or walking if she's not up to either of those. For resistance training, I'm also going to have her do that 2 times a week. Again, moderate intensity, about 65%, 1 RM. 30 minutes, and this is going to be resistance band exercises. These can be seated or standing, including elbow flexion or upper back exercises. For flexibility, we're going to do that 3 to 4 times a week at a low intensity to the point of feeling tightness. Again, for about 20 to 30 minutes, and for her, we're going to focus on static stretching. Some special considerations are to ensure rest time between sets, provide proper safety measurements. This can include asking her doctor for approval of her exercises before we do any of them, and just making sure she feels safe when she does them all. She'll be monitored the whole time, so that shouldn't be a problem. We're also going to include exercises tailored to the patient. Since she has low joint mobility, we're going to include both standing and sitting exercises. We're also going to make sure to have plenty of water for her. In conclusion, there are many different types of intellectual disabilities that require different types of support. It's important that someone with an intellectual disability works towards independence, not only when they're young, but also when they're old. This will also help them feel confident if there isn't somebody always around. And then lastly, set achievable goals to help promote self-confidence. And then here is my reference list. Thank you.